Passage Physical Therapy out of Gainesville, Florida. How are you all doing today? I would like to introduce to you all to Sharon Hepburn, who is our COO out of our St. Louis location in Missouri.
Hello, everybody. Thank you so much for joining us for our first Facebook Live. This is very exciting. And please excuse any learning mistakes that we have along the way. I want to let everybody know that Clear Passage is up and running for business. We have been opened all through COVID and take all the COVID precautions, but also we leave our masking options now up to the patient. So if you prefer to have a mask, our therapist would be more than happy to accommodate you. Come on in and get treated, and we'll help you with your infertility issues and your small bowel obstructions. So this is the end of Women's History Month, and what's really, really exciting is that our company, Clear Passage, was founded by Belinda Wern and her husband, Larry. Belinda, when she was 20, was diagnosed with cervical cancer. And the treatment of choice back then was to put a rod of radiation inside her vagina it was a couple of days, and then they did it again. So it was over a 2-week period. Cured the cervical cancer, but also caused massive adhesions throughout her body, especially her trunk and her abdomen region. She was in so much pain, she could not work. She was diagnosed with frozen pelvis, and the doctor said, "We don't know what to tell you. We cured your cancer. You're alive." And Belinda said, "I'm alive, but I can't move and I can't work and I can't live a life." So that's when her and Larry went around and started looking for self-help treatments. And Larry is a massage therapist and Belinda is a physical therapist. So as they started probing and looking, they came up with a way to help adhesions loosen. So Belinda eventually actually became pain-free, more functional, and they opened up clinics dedicated to helping people with abdominal adhesions. So our hats off to Belinda for a wonderful job since it's Women's History Month. But Belinda and Larry, what a great company.
Yes, yes. So, Sharon, what are adhesions and how are they formed?
Great question. Adhesions are internal scars. Anytime there is an accident, a fall, a surgery, infection, inflammation, trauma, radiation damage, or even endometriosis, these adhesions or internal scars form. Like scars that form on the outside of your body, adhesions are scars that form on the inside of our body. It acts like a powerful straitjacket and squeezes everything, nerves, organs, joints, and it causes a lot of dysfunction, causing internal pain, female infertility issues, chronic pain, small bowel obstructions.
What's the CP role with adhesions?
Oh, so since Larry and Belinda developed this technique to decrease adhesions and help break them apart. So adhesions bind on to something to keep them steady. And so what Clear Passage therapists do is they come in and they pull these adhesions apart, pull them off where they're adhered to. And what happens is eventually our organs start to move on each other again. With internal adhesions, we have like this straitjacket, this glue. If you think about noodles that have been cooked and then drained and then left in that colander for a long time, how they're all stuck together, Clear Passage kind of comes in and pulls those noodles apart so they're individualized again. So it pulls the organs apart with the adhesions, pull the adhesions away from the organs so they can move again, so we can become more functional, increasing fertility, increasing hormones, decreasing bowel obstructions. It's really amazing work.
Wow, that's very interesting. Adhesions affect so many things. Maybe today we can talk about how adhesions affect female infertility, since it is, Women's History Month, and how clear passage can help. Let us start with blocked fallopian tubes. Sharon, what are blocked tubes, and are there other names for blocked tubes?
Great question. Blocked tubes means simply that the fallopian tubes going from the uterus to the ovaries are blocked. And how can they be blocked? It could be an adhesion pooling on them. So here's your tube, and it could be an adhesion pooling. So it's scar tissue blocking them, or it could be blocked with some fluid in there. And a name for a blocked tube with fluid is called hydrocephalus. So if your doctor tells you you have hydrocephalus, it's a form of a blocked tube.
Wow, interesting. How are blocked tubes diagnosed?
So there are a couple of ways blocked tubes are diagnosed. The first one here you can see on the picture on our Facebook Live is a picture of a dye test. On the left side, you could see where the uterus has dye in it, and off the uterus, circled in red, you cannot see any dye at all. And then on the right side, you could see the uterus again, and this is after clear passage therapies. And in the green circles, you could see where that spill, so it's called a spill test. You could see where that dye has spilled over into the ovaries, and you can see where the fallopian tubes are lit up with this dye. So that's one test. And we love this test because it really shows the benefits of clear passage, the spill test. And that's how we first found out we were opening fallopian tubes. Another test that people have is also ultrasounds. Your doctor could go in and see not necessarily scar tissue, but it could see a little bit of that fluid that we were talking about, and that will reflect back in an ultrasound too. So there's a couple ways you can figure out if you have a blocked tube.
Wow. What is clear passage success rate in opening tubes?
Oh my gosh, phenomenal. So 69% of women prior to tubal surgery have open tubes in our studies. That rate beats any surgical rate out there. It's wonderful. 35% of women with surgeries for blocked tubes. So if they went in for tubal surgery to unblock their tubes and it didn't work, then we're effective 35% of the time. But you got to remember, every time you have surgery, you create more scar tissue. And then we actually have a real nice rate of opening fallopian tubes with endometriosis also, so that we have 60% success rate with people who have endometriosis and blocked tubes. So our rates are really, really good and better than surgery.
Wow. How come my medical doctor hasn't heard of y'all?
First, when doctors go to school, they learn about their road. They learn about what's going on with them. So they haven't learned about all adjunct therapies. They haven't learned about physical therapies. They're learning about what they can do medically. Okay. So coming out of school, that's where they're thinking. And then sometimes, and I really hate to say this, but surgery is what's going to make your doctor money. Sending somebody off to physical therapy is not a money maker. So that could be another reason why the doctor hasn't heard of us. And lastly, we were pretty edgy. Clear passage was pretty edgy 25 years ago. So we're just becoming mainstream. Doctors are just starting to talk about adhesions. They're just starting to talk about how adhesions affect fertility and also affect small bowel obstructions. So I think more and more, if we fast forward another 10 years, it's going to be a lot more mainstream than it was 25 years ago. We're on that cusp right now.
Mm, that's awesome. I love working here. I love being a part of it. And he's just also affects so many other female infertility issues, such as age related hormone issues, endometriosis, and polycystic ovarian syndrome, known as PCOS.
Yes.
Tell me about age in FSH and LH.
All right. And personal note, I just had my FSH and LH taken yesterday. So FSH is made by your pituitary gland. Pituitary gland is sits in your brain on top of your sphenoid, which is this bone going across your head. So your pituitary is behind your eyeballs, behind these fingers, and it's a small gland. FSH is follicular stimulating hormone, and it plays an important role in sexual development and functioning in women. FSH, or follicular stimulating hormone, helps control the menstrual cycle and stimulates the growth of eggs in the ovaries. So it stimulates the growth of eggs. LH is luteinizing hormone, and again, it's made by the pituitary, that small gland in your brain, and it also plays a really important role in sexual development and functioning in women. LH helps control the menstrual cycle, and it also triggers the release of an egg in the ovary.
Wow. Okay. So, how much change is there in the hormones after therapy with clear passage?
I love talking about this because it was a total surprise when Clear Passage noticed an improved in hormone and fertility with women who had high FSH. So typically, FSH levels are measured on day 2 through 5 of a woman's cycle. And these FSH levels rise as a woman approaches menopause. The reason why I had my FSH taken yesterday. When FSH levels are above a 10, most reproductive physicians consider the patient to be subfertile or infertile. In fact, many reproductive endocrinologists will not even consider performing IVF or in vitro fertilization on women with an FSH of 10 or above. So there is no medical standard treatment to improve fertility with women with high FSH. There's no comparisons, but physical therapy with Clear Passage was phenomenal. In a 10-year study, Clear Passage therapy treated 122 women who were diagnosed fertile or subfertile due to a FSH level above 10. The therapy improved that FSH level or yielded pregnancies in 49% of the women. 49% of the women. And 39% of those people became pregnant after therapy. So I just threw out a couple of numbers. So 49% of the women increased their FSH levels, and 39% of them became pregnant.
Wow. Wow. So they become pregnant naturally after this treatment. That's great news.
Yeah. So from what the study I just shared, about 90% of the pregnancies were natural, and 10% were by IVF.
Wow. Okay. So clear passage also helps with IVF. Do you have any data on that?
Actually, yes, look at this. So our IT, Mr. John, put it up for us. Check out this chart. It is simply amazing. It really is wonderful. If you look at the data, in this gray box, it looks like a triangle on the bottom. That is the medical standard IVF success rate. So for just medical standard without Clear Passage therapy, if you're under the age of 35, you got a 45% success rate. If you're between the ages of 35 and 37, you got a 37% success rate. Go all the way down the age group, and if you're over 42, you have a 9% success rate. This nice aqua box above is the IVF rates after Clear Passage. And this is phenomenal. You can see our success rate just booms after Clear Passage, helping women get pregnant with IVF. So at the age of 35 or under, all of a sudden we have a 68% success rate of people becoming pregnant with IVF. And if you look way back over here at over the age of 42, where standard medical treatments and IVF were only 9%, with Clear Passage therapy, look at this jump. It goes all the way up to 44%. And so I would have to say a lot of our female infertility, if you really look at this age 41 to 42, that jumps up to 54%. That is really, really significant. And that's because we're helping the ovaries move in the body, and we're also helping the FSH and the LH. I really want to call your attention to the bottom here, and that is a p-value. And who cares about p-values? But I have to show this because anything less than a 0.05% shows a statistical probability. It's statistically significant, and saying that this wouldn't occur just out of the ordinary. And look at our p-values: 0.01, 0.01, 0.00, 0.00001. So our p-values are off the chart, meaning that this is not just going to occur by accident. It's because therapy intervened.
Wow. I absolutely love hearing from our patients when they become pregnant. It just brings an excitement to the office amongst, the therapists and the staff, just to know that we have someone reach a goal in their life that they wanted to become a mother. We also treat endometriosis. And what is endometriosis?
Oh, wow. Endometriosis it's actually really, really painful. It's where endometriosis, it's the tissue that normally lines the inside of the uterus. That endometrium is now found outside of the uterus in other parts of the body, frequently on the internal organs, your small intestines, your large intestines, outside of the uterus, on the ovaries. And frequently what happens is they start to form these bonds or adhesions. So they start to lock everything down. It starts to get really, really tight. The most common area for these misplaced tissues are the reproductive organs, like I was saying. So these adhesions act like glue, and it inhibits fertility and as they squeeze, because nothing can get through. And they also cause pain. So a lot of times, abdominal pain and cramping. Misplaced endometrial tissue is usually called implanted endometrial tissue. And implanted endometrium responds to the menstrual cycle. So it's just like it would be the endometrium inside the uterus. It responds just like that, even though it's outside of the uterus. So it swells during every menstruation. Yeah, it's hurting already. But unlike the menstrual fluid in the body that goes ahead and flushes out, implanted endometrium cannot exit the body. The inflammation that accompanies the swelling can cause more adhesions. So now we have more adhesions all through wherever those sites of the implants were, and which is causing what? More adhesions, more gluing down, more inability to move.
Wow. So does CP Clear Passage really work with endometriosis?
Yes, it does. So a lot of the endometriosis presents with painful menstruation, painful intercourse, and infertility. And Clear Passage works with all of that. I had a patient who was having just that painful intercourse, painful menstruation, couldn't get out of bed because of the pain that she was having. And she came to Clear Passage just because she wanted to be able to grocery shop and go to some of her kids' functions at school. After a week, after 20 hours of therapy, She was so happy. She was going, "Ooh, my pelvis moves. Oh my gosh, I don't have low back pain. Oh my gosh, I don't have neck pain," because all that endometriosis was pulling on her.
Mm.
She felt so good. But that's just my story. That's my little story. We actually have research. Clear Passage has been phenomenal about research and just not case studies.
Mm.
In a 10-year study, uh, Clear Passage showed a pregnancy rate of 43%. And that's pretty comparable to the 38 to 42% cited for surgeries with endometriosis. But that's 43%. And Clear Passage avoids all the risk of surgery. And it avoids the cost of surgery, anesthesia, and accidentally cutting through anything else, and post-surgical adhesions. Because remember, anytime you have surgery, you're going to have more adhesions.
Wow, wow, that's very interesting, especially about endometriosis. I want to be conscious of everyone's time. So let's wrap up and talk about PCOS, which is polycystic ovarian syndrome. Sharon, what the heck is PCOS?
Great question. So, not a lot is known about the etiology or what causes PCOS. It is considered a hormone disorder. We at Passage speculate it's a mechanical aspect of PCOS as well, that the ovaries become covered with a collagen fiber, which is the building block of adhesions. Why do we think this? Our thoughts are based on a combination of what we see present in the clinic. When you look at surgical films, we can see a thick covering over the ovarian wall. And then we also witnessed a high number of fertility reversals or infertility reversals in patients with PCOS after we treat them. Because our therapy addresses both the mechanical, the adhesions, and the hormone aspect, remember we were talking about FSH and LH earlier, we feel that both aspects addressed together when treating PCOS makes the client more fertile.
What are the signs and symptoms of PCOS?
So I know quite a few people who have PCOS, and I'm going to repeat it again, but that general presentation is a little bit overweight, thinning hair, and a little mustache. But this whole list here, hair loss, no periods, depression, thinning hair, irregular periods, acne and oily skin, weight gain or overweight or obesity, excessive hair growth, especially on your face or your back or your chest, and obviously infertility.
How's PCOS surgically treated?
Mm-hmm, mm-hmm. And it's kind of barbaric. So remember, all of the ovary is covered in this thick collagen fiber. So surgically, they go in and they punch holes into this fiber and through into the ovaries, so the ovaries can release eggs. So it is a surgical intervention, and it is pretty traumatic for the body and for the ovaries.
Mhm. And how does Clear Passage help with that?
So Clear Patches, it does more of helping break apart the adhesions. And so not only are we treating the adhesions, the mechanical issues, because we're breaking apart, allowing ovulation to happen, but we're also treating the hormone aspect of it also, because we're helping that FSH get back down into normal levels. So by treating both the mechanical aspects of adhesions. And so it's going to help with infertility, but it's also going to help with pain. It's also going to help with your menstrual cycles. And then as we help with the hormones, it might actually help with some of the depression that you're getting because of the syndrome and the hormone levels in general.
Wow, wow, that's a lot of information we
Yeah.
just talked about. Let's let that sink in for a few minutes, and let's wrap up. Before we do our Q&A with location and prices. As I mentioned earlier, my name is Brenda and I'm the administrator in Gainesville, Florida, which is our headquarters. This is where you will find our actually scheduling team. This is where Larry and Belinda Warren started out at, and they are still in the office, on a rare basis, but you will see them if you come here more than likely. We do have other locations throughout the US and UK. We have a location in Dallas, Texas. We have Pasadena, California, which is the metro LA area. Rochester, Michigan, St. Louis, Missouri, which is where Sharon, our COO, is located and a wonderful therapist. Reno, Nevada, Oakland, California, Encinitas, California. We also are in London and in Canterbury. So, like I said, we have locations throughout the US and in the UK. You give us a call at 352-336-1433, or you can email us at info@clearpassage.com for more information, or go to our website, which is www.clearpassage.com. And you will get a lot of information about us on our website. Call us, speak to one of our scheduling coordinators. They will be able to answer questions for you, get the information that you need for Clear Passage to help you make the best decision for you.
Wow, a lot of information, but that was fun. I think we did well for our first Facebook Live.
I
Let's
do
look
too.
to
I think
see.
we did great.
I think so. Let's look to see if there's any comments. I'm actually on the wrong screen. I'm looking at private chat. So let's see if there. Oh, we got a lot of comments.
Oh,
All right. I'm going to punt this one to
okay.
you, Brenda. Do we accept insurance or cash?
We do not accept insurance. We are a cash basis. How we do it is when you first call in and you schedule your appointment, it's a week long, physical therapy. It's 20 hours. You put down your deposit. And once you are scheduled, we hold that date for you. And you have 10 business days from that date to pay the balance of, the balance of your therapy. We do take care credit, but we do not take credit cards. We give discounts on if you pay by cash, by wire transfer, or certified funds.
Perfect. I'll take the next question. It says, what if I had surgery to remove endometriosis, but I still have pain? We can help. Great question. A lot of times when we have surgery to remove endometriosis, a lot of times that all of the endometriosis is not removed. Secondly, that surgery causes adhesions. Thirdly, you might be removing endometriosis, but you're not addressing all the adhesions in the body anyway. So we could help things start moving and gliding on each other again. And fourthly, even if you had surgery, you haven't affected the ovaries and the pituitary gland to help with the hormones. So yes, if you are still having pain after surgery, we definitely could help, and you will feel, it's hard. You're not allowed to say, I promise you. But I'm going to be pretty close to saying, I promise you. I haven't had a not successful endometriosis patient.
Wow, that's awesome. That's awesome. There is one question here where someone wanted to know more about care credit for payment. Care
Okay.
credit, you would apply for that yourself. Can get approved. They would tell you how much you're approved for over the phone. We do take care credit. We have a 6 months or 12 months no interest. That's if you pay it off over those 6 months or 12 months, you're not paying any interest on that. Now we do from 24 to 36, 48 months, there is interest, and then it goes up to 60 months where the interest is a little higher. But we have a lot of people that come in, a lot of patients that come in with care credit, and they choose the 12 months because they feel they can pay off the balance of it over the 12 months with no interest.
Perfect. So we can make it affordable for everybody.
Mm-hmm.
And it's definitely well worth, people buy clothes, people buy trips. If you want to feel good,
Mm-hmm.
consider Clear Passage Therapy.
That's
Do we
right.
have any other questions? I don't think so.
I don't think so.
And citizens of Bright House, thank you so much. What a great therapy. Appreciate it.
Thank
We
you.
think it's wonderful.
Mm-hmm.
Okay, so give us a holler. And I think we'll go ahead and let John stop the Facebook Live and come
Mm-hmm.
back to our little call here. So thanks, everybody. Thanks
Thank
for
you
joining
so
us.
much for tuning in. We hope to see you again soon.